lately, or maybe for some months or years now, you might have been experiencing extremely tiredness, or sometimes you often urinate frequently. Maybe you feel thirsty, sometimes your throat, maybe you feel thirsty because your throat is usually dry, and you are often worried, and you have been asking yourself what might be the cause of this situation. It might be diabetes, according to medical studies. And in Cameroon, according to statistics, we have 5.5% to 6.9% of the adult population are suffering from type 2 diabetes, which is a problem, a public health concern in Cameroon. Reason why each year Cameroon joins the world on November 14 to observe the World Diabetes Day, highlighting the essence of awareness, screening awareness, also sensitization in order to curb the disease. Today we'll be looking at what diabetes is all about with a general practitioner. But before introducing our guests for the day, I have the honor to introduce my co-host. Good afternoon, Immaculate Fogre.
Good afternoon to you, Lucy. Good afternoon to our guest of the day, and equally good afternoon to our listeners and, of course, televiewers. It's a pleasure being here.
Always a pleasure, Immaculate Fogre. And our special guest for the day is not a person than Dr. Bonny, Laurette. She is a general practitioner at the Mboppi Baptist Hospital here in the city of Douala. Good afternoon, doctor.
Good afternoon.
Thank you for honoring our invitation this day.
You're welcome.
And first, we would like to find out from you. It is your domain. We'd like to know, what is diabetes all about?
Okay, I'll start with saying diabetes most of the time is a chronic disease. That means it's a lifestyle disease. It's a lifestyle disease that affects many people in Cameroon right now.
Yeah.
So diabetes is it deals with insulin. That means either the person has either less insulin or resistant to insulin, and this causes the person not to be able to transform the glucose in their blood into energy for other source to be used. That different types of diabetes, but it mostly deals with the amount of insulin in a person's body.
So what are the main types of diabetes that we have in our country, in our context?
Okay, I think here in Cameroon we have different types of diabetes, but mostly we have type 1, type 2, and gestational diabetes. Type 1 diabetes simply deals with the individual has no insulin. That means the pancreas, that is an organ that produces insulin, doesn't function properly. So the individual has like little, or I would say no insulin some of the times, and this causes the person not to be able to break down glucose into other forms of energy. Yeah, so the person has excessive glucose in their body. While for type 2 diabetes, it's a lifestyle diabetes. It's more or less the person has insulin, but it is resistant. So it cannot function as it normally should. So it rather stays in the body. It tends to keep high sugar, and it doesn't function properly. Why for gestational diabetes is mostly pregnancy. That means it happens to women who were normal before pregnancy, and maybe in the 20 weeks, I'll say 4 months of pregnancy, they develop diabetes. But this one can be regressible. That means after giving birth, the person can become back to no diabetes again. But most of the time, you can continue to just have diabetes for life. Yeah.
Now, in my introduction, I made mention of frequent urination test as some of the symptoms. What are the other symptoms when it comes to diabetes?
Okay, as you rightly said, frequent urination is actually one of the symptoms of diabetes that a person can notice. A person will go to the toilet, like you urinate like 5 times or 6 times a night, and maybe during the day a little bit more. There's also fatigue. You just feel tired and exhausted without actually to do much activity during the day. There's excessive eating. You eat a lot, you just feel like it's my appetite, I just want to eat, but that's not normal as well. And there's drinking, you just feel thirst. I know we all live in Douala and it's a bit hot here, but still drinking that much might not be the best. So it's good to check. There's drinking, there's other problems. You can have neuropathies. Neuropathies, the nerves in your body are abnormal. So you have like tingling sensation on your feet and your lower extremity. Sometimes it even goes right up to your hands. You also have other things like for men, you have sexual weakness. You can have, for women, you can also have vaginal infection. You have frequent vaginal infection all the time. That can also be one of the causes of symptoms of diabetes.
For those who like to participate on today's edition of the program, here are the numbers: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Those are the numbers you can call and ask your questions about diabetes. Back to you, doctor. I want to know from you, how common is diabetes in the case of Cameroon?
Diabetes is actually very common. Like, you'll be surprised with the amount of people who are living with diabetes in our country, actually. They say the percentage can be between, I would say, 5.5 to almost 6% of Cameroonians are living with diabetes. So mostly the ages are between the age of 20 to 79. So these are people that frequently can't get diabetes. And in Cameroon, let's say from the year 2000, we had the prevalence of diabetes, almost 61,000 people were living with diabetes then. And by 2014, we had almost 77,000 people living with diabetes, with the projection to be almost about 1.9 million by 2050 or by 2030. So it's rising.
Now, you made mention of 3 types, which is gestational, type 1, and type 2. Let's begin now with the gestational, which occurs in pregnant women. Is there something that could trigger it? Is it their lifestyle or something when it comes to pregnant women?
Okay, with pregnant women, it's a bit difficult because it comes with babies. Like, the fetus can sometimes affect the woman's metabolism, so she cannot easily break down glucose as necessary. Why with and that is not really something you can do. More or less, I would say, with the diet for a pregnant women, what you eat and how you take care of yourself and how you do your normal screening. Sometimes you cannot help it, but proper screening will easily catch it on time and will prevent any complications to mother and child.
Okay. Now, when it comes to type 1 and type 2, which one is very common?
In Cameroon, we have mostly type 2. Type 1s are available as well, but not that much as compared to type 2. So I would say, if I'm giving a ratio, I would say probably 80-20.
Okay.
We have 80% of Cameroonians who are diabetic, type 2 diabetes, and 20% can be type 1 diabetes.
In our country, how is diabetes diagnosed?
Okay, for us, we start with the basic, just doing a fasting sugar level. Like I was explaining, fasting sugar level simply means you take your sugar level after 12 hours of no meal. So if your last meal was at 6, that was your dinner, you can take your sugar level early in the morning, let's say by 8, to be sure, and that will be the first step. If it is greater than, I would say, we always say 120. It's a bit difficult to explain, but if it's greater than 120 milligrams, that means there's something we have to go for to do more testing. You can also do what's called a random sugar level. Random simply means if you have eaten or not, it doesn't matter, or 4 or 3 hours after your meal. If it is greater than 200, then we are saying that the person might possibly have diabetes, but it's just, was he trying to get the root of it? Then there is also what we call urine. We'll take your urine sample and we do a test on it. If we find that glucose cells in your urine, that can also prompt us to worry about, to think about diabetes in the patient. That will be like the basic, the first step before we go on to further testing. Further testing is to check the person's hemoglobin A1C. Hemoglobin A1C here, it directs us on the sugar level for over 3 months. So this tells us how this person's sugar level has been for as long as 3 months. The normal level should be less than 6.5, but if a person is diabetic, it will be greater than. Some people go as high as 14, 17, wow. So that's very high.
And doctor, we do know that diabetes, we can say diabetes is a stubborn disease, because sometimes when you consume something, they might say you consume this fruit. Even though you consume the fruit, you still have the insulin level still very high. So now we would like to find out what lifestyle changes can we implement in order to better manage this condition.
Okay. For lifestyle changes, right, diabetes is actually, as we always say, it's a lifestyle disease. I would say the doctor, the nurses, they have like 20% to play in diabetic management. More or less the patient, the family, and everybody plays more part. So what you eat actually is very important. I won't say there's any particular restriction. What I would say a person can avoid would be direct carb, flour, things that the person can worsen take the sugar up too fast. But normal food, like what we normally eat in the past, vegetable, cocoyams, cabbage, more vegetables will be much appreciated for this patient compared to other things. Spaghetti, bread, we can try to avoid them. or reduce the consumption. I know it's a bit difficult to avoid,
especially in Douala.
In Douala, yeah.
Especially.
So looking at the let me say the plate of a diabetic patient, in summary, in the morning, how should the breakfast look like?
Okay, I always advise some of my patients to like you put your meal in balanced form, like in a very balanced diet, more protein, more veggies, less carbs. So if I'm going to have like a plate, I'm doing like a diagram, I'll have probably 1/3 of my plate will probably be just veggies. Then a quarter will probably be high protein, beef, anything that's going to increase the protein level, and then the little percentage that's left will just be something for carbs. If you must eat carbs, actually. So most carbs, we try to reduce the quantity of carbs and more protein, more veggies.
Yeah, I was equally told that maybe if you're consuming 2 plantains in the afternoon, in the evening you should consume 1.
Okay.
How does it?
Okay, what I would say is, if you're for example, let me give an example. You wake up in the morning and the person has salad for breakfast. In the afternoon, you have something like a bowl of rice. Let's say rice. In the evening, I advise to have something like cucumber. Something very light, so it doesn't overtake your sugar level higher up. Or you have a bowl of veggies, maybe a bowl of cabbage stir fries. That would be good for you. That's it. So reducing the quantity of plantain doesn't really change the amount of carbs. It's more like unless you reduce the food, I'll say the food type. If you add more carbs in the afternoon, try to eat more veggies in the evening. Or if you add more protein, you can have a bit of carbs in the night. It's just.
Now, in Cameroon, we have this mindset of 3 square meals, like eating morning, afternoon, and evening. As a medical professional, do you think it's the right thing to do, eating 3 times a day?
I know I think we have had this, the host for how many centuries now? The world has had it, like breakfast is the most important meal. Yeah. But I think that knowledge is changing more or less right now. That breakfast isn't as important as we all assumed or we all thought initially. That a person can actually live on at least 1 square meal or 2 square meals a day, and that's fine. Lunch, a big lunch, and maybe a light dinner at the end. You must not have breakfast. But for a patient with diabetes, it's a bit different. They have medication they're taking, so it's a bit difficult for them not to miss a meal. But for a healthy person who wants to be healthy, missing 1 or 2 meals isn't a problem. I think taking a few, an hour or 2 extra to fast. For example, you break your fast, you wake up in the morning, you slept you ate your last meal at 8, and you wake up in the morning by 7, you have to go to work. If you don't eat, you probably eat later in the afternoon by 12. That's a good thing. You've pushed your fasting, your body has been in that mode of low insulin for a longer period of time. It reduces diseases and other chronic diseases coming in the future. It helps a person to do that.
Okay, in the course of our conversation, you outlined the fact that lifestyle plays a very great role in managing diabetes, and you equally highlighted the fact that dieting plays even a much more greater role. Now, let's look at this aspect of World Diabetes Day, which is commemorated every 14th of November, as Lucy earlier said. Do you think this commemoration is having the impact people want to send across to the world?
I think for Cameroon, I would say some, not as much as it should be, but actually there's actually some impact. There's a bit more people testing for diabetes lately compared to people doing it before. Because of the awareness. Maybe even this program we're doing right now might help somebody decide to test and check themselves.
For sure.
Yeah, because this Diabetes Day was created November 14 to actually increase awareness among people to know that people living with diabetes and how to help them, how to properly manage the disease. So I think it's doing something.
All right, so looking at the World Diabetes Day that was recently celebrated, but I think that most people do not still go in for screening campaigns. So what is the problem? Is it that Cameroonians are not really informed about the essence of some of these screening campaigns, which most times are free across hospitals?
I think you're right about it. People are not really properly informed, and Cameroonians are not people that like to read a lot. So I think sometimes maybe more posts on social media about this campaign might help people, might really indulge, and then probably where we do it. So people leaving work will not think of, let me go to the hospital and get myself tested. So more open campaigns can help, like open places, markets, can actually help more people get tested, because it's in your way. You definitely do it because you're going to the market on that day. So that will help too. And more campaign spots can be good for everybody.
For those who like to participate on the program, we have the numbers on the screen, and also here are the contacts: 670 5470 490 656 622222.
All right, back to you, doctor. We know that in Cameroon is somehow challenging managing diabetes, especially for patients. So what are some of those challenges these patients face?
Yeah, actually, it's very challenging. Diabetes medication is quite costly. I won't say it's very, but it's actually costly for an average Cameroonian, yes,
okay,
to get to buy it every month. And the people who have poorly controlled diabetes also have the tendency of getting higher medication. Like, for example, you have to take insulin, which means you have to definitely inject yourself every day, 2 times a day or once a day. And it's actually I think it's very costly.
How much?
I think insulin can be roughly about 6,500.
That's for one?
That's for one vial. That
Wow.
can take you can take some people less than a month, and others take them more. And that's not all. You have to take some oral tablet as well, which is actually expensive. So roughly, a person has to probably save at least maybe 10,000 just for diabetic medication every month.
Okay.
Therefore, what message do you have for Cameroonians out there?
I'll say testing is. I'll probably say know your weeks, know your response. So if you know, we are all Africans and we have higher weeks of being diabetic. We are all blacks. It's more in our community than other Caucasians or Hispanic community. Ages as well. Early 30s, late 20s, early 20s, or up to 70s. Very important. That's really the weeks for us. Our parents, if our mother, our father has diabetes, we can also have diabetes. So if we know our risks, we know our response. So this means that we should all get tested. We check to know what we are doing, check to know where we are on our level, and also our lifestyle. What we eat is very important, not just how we look, but what enters us is actually as important as well.
All right. Thank you so much, Dr. NDIFOR Bonny, for being our guest today. She is a general practitioner at the Mbopi Baptist Hospital right here in the city of Douala. Thank you so much, Immaculate Fogwe.
It's a pleasure, Lucy.
Thank you, all ladies and gentlemen, for staying with us till the end of this health program. For presentation, I have been Asia Lucilengu, and we received technical assistance from Louis Pego and Jonathan Babiola. Do stay in the company of interesting programs on Equinoxe Radio and television.